The National Coalition of 100 Black Women's West Palm Beach chapter, Community Health Education Talks. We would like to take the opportunity with this program to highlight health issues in our community. Good evening and welcome to our second season of the Health Spot. This program is brought to you by the National Coalition of 100 Black Women. We are a volunteer organization that advocates for women and girls in our community around such issues as health, economic empowerment, leadership, and advocacy. My name is Charlotte Leonard, and I am the co-chair for the Health Committee for the West Palm Beach chapter of the National Coalition of 100 Black Women. Thank you all for joining us tonight. This is our second season. As I said earlier, we look forward to bringing you lots of information this next few months on the health issues in Palm Beach County impacting women and girls. I'd now like to turn it over to my co-chair, Sabrina Cooper, who will introduce our guest speakers for this evening, and she will also lead them through the questions. Thank you. Sabrina, take it away.
Good evening, everyone. And again, welcome to our second season of our Health Spot with National Coalition of 100 Black Women, our West Palm Beach chapter. Tonight, we have some phenomenal women that will be giving us some fantastic information that will help us in our health journey. I'm going to ask each one of them if they will introduce themselves, and we're going to start with Linda Long, and we'll go from Linda to Rashawn, from Rashawn to Deidre, in that order, please.
Good evening, and thank you so much for having us. As you know, it is Breast Cancer Awareness Month, and we like to do whatever we can to promote early detection, and early detection we know saves lives. And I am Linda Long. I'm a survivor. I was diagnosed in 2004 and a second diagnosis in 2015. I am the president, and I am so glad to be a part of this informational meeting tonight. Thank you.
Good evening, and thanks again for having Sojourners with Healing Hearts. My name is Rochelle McRae. I am a nurse practitioner, and I joined Sojourners with Healing Hearts as a partner. First, I was partnered with them with the Palm Beach County Black Nurses Association. Then I came aboard as one of the board members to assist Deidre with information in the community about other things besides breast cancer. We talk about all types of hypertension, diabetes, because when you have breast cancer, you just don't have breast cancer. You have other medical conditions as well. So thank you again for this invite.
Ms. Deidre?
Oh, good evening, and thank you again for allowing us to share this evening with you. I'm a nurse practitioner at Florida Cancer specialist in Palm Beach County. We have a practice of over 100 practices in the state of Florida. We have 4 satellite offices in Palm Beach County. I specialize in breast oncology and genetics. I am one of the original founders of Sojourners with Healing Hearts. I'm a member of the Black Nurses Association and the Black Nurse Practitioner Black Nurse Practitioners of Palm Beach County. And again, I'm so happy to be here with you. Thank you.
And you're also my high school classmate from 1977.
Oh, wow.
Our age, but
Yes, we're still hanging in here.
Wow.
Again, thank you, ladies, for joining us. And as Charlotte has said, we're going to be talking about breast cancer, and I'm going to be asking you a series of questions so we can educate our Facebook family and friends. So we've been talking about this organization called Sojourners of Healing Hearts. So my first question will be to Linda Long. What is Sojourners of Healing Hearts, and who does this organization serve?
Sojourners with Healing Hearts is an organization that we bring into the community information regarding breast cancer, early detection. We serve women of color, but we will also serve any woman that is having and afflicted with breast cancer. It was organized, like I said, in 2004 for women. There were a number of women, and you can't believe it. And when I tell this story, there were about 5 women in our church at the same time that was diagnosed with breast cancer. And we learned that there was not a lot of information resources for us. So Deidre, who was a member of our church, we spoke with her. I was one of the founders and one of the women that was afflicted with breast cancer. And so what we did was we talked with her, and we talked with the leader of our health and wellness ministry. And in October of 2004, we had our first outreach, which was 100 Women in Pink. And at that time, we were so overwhelmed because we didn't know that there were that many African-American women that was afflicted with breast cancer. Because one of the things we found out is that we never talked about it. And so one of the things that we started doing was letting you, it's not your fault. We can help you. We need to help you, and we need help. And so not only did we start fundraising to help women who were underinsured, we found, and some had no insurance, but there were those who could not afford, the treatments. So what we do basically is we help families who have women in their families that's afflicted with breast cancer. We help with co-pays, we help with the bills, we help with food, we help with transportation. And the biggest project that we have that we're really proud of is our going into the community, our mammogram project, where we help and pay for women who need to have breast cancer screening. So that is our big project. That's what we are proud about. And this year so far, we've paid for 50 women to have mammograms. And we will be doing it again this Saturday, our project coming up, Better Together in the Community. And we will be paying for mammogram screenings. And we will have other organizations talking about what they offer to the community. So we are happy to help our women of color, and we never turn anybody down. Thank you.
Thank you so much. Well, now that we know what Sojourners of Healing Hearts is all about and when it was established and what the organization is, I'm going to ask either Roshan or Deidre if one of them would just jump in and tell us what is breast density.
Well, that's an excellent question, because density is what you saw in the sky today. I don't think all you saw were thick white clouds. On my way coming home, I said, this is an excellent example. You know, planes are back in the background of those clouds, and tonight you will not see the moon or the stars. That is what makes dense breast difficult to find a lump. Lumps on a mammogram appear as white, and these clouds today covered the sky. I didn't see any blue. That's white. And so if you have a background of something white on top of something white, or think of Alaska flying over the tundra or flying over snow. If a white animal was down there in the snow, you wouldn't see it until you got up on it. That is what is density. And it is why we have to do additional testing in order to shoot beyond that density. Planes are flying out there above that skyline. We hear the planes, we know the planes are back there, but you can't see them because the sky is dense. The breast can have this exact appearance on a mammogram. That is the best way I can describe density.
Thank you. That was
and I'd also like to say, you can't feel density. You won't know how dense your breasts are until you have the very first mammogram. And the density tends to be more prevalent at an early age. As we get older, the level of estrogen decrease, the fat content of our breasts change, the density is lightened. But I've seen patients in their 80s and 90s and still have that dense breast. And so we need to cater our screening mechanisms based on individual appearance of the breast. Some people only need a mammogram. Other people need a mammogram and ultrasound. And then there are others who have breasts this dense today the density of the sky today will need an MRI.
Thank you. That was such a very great explanation. You know, we can understand what breast density is all about. So thank you for explaining it to us that way. So now we really know what it's all about. So my next question will be, when should you start getting breast screenings? Rashawn?
Deidre will answer that question, but I wanted to say with the breast screenings, like I did with mine, we never know when you're gonna find a lump. Prime example, I think about 4 years ago, I have very dense breasts too. I found out when I had my first mammogram. And one night I was showering, probably about 8 o'clock at night, and I felt the lump. It was the size of a marble, about this big, probably this big here. Everybody see that? Like a marble or a bottle cap, like Deidre said, a bottle cap that size. But by me being a nurse, I kind of knew it wasn't cancer, but still, it's still frightening. But it moved. It was able to move. I could move it up, down, left, right. But I still went to Deidre's house 9 o'clock, 10 o'clock at night and let her examine that breast. But I had to get it removed because, like Deidre was saying, now I have to go every year for an MRI, a mammogram, and an ultrasound. I just had my ultrasound done 2 weeks ago. My doctor called me with the results. I have to go back 3 months later because of my density of my breast and where that lump was. I got to make sure nothing's coming there. So Deidre will let you know it's important to get the breast screening, and she's going to let you know the details about the breast screenings.
Okay, so Deidre, when should we start getting breast screenings?
So there's different rules for different people, different strokes for different folks. And so for a woman with average risk, it should start at the age of 40. But we encourage every woman to look at her own personal risk. And so when you see your gynecologist or your primary care, your primary nurse practitioner, you need to ask when should you personally start, because that answer is going to depend on your family history, whether or not you have individuals in your family who has had breast cancer, and it depends on the age of those individuals. So let's say you are a woman who developed breast cancer at 30. That's a very young age for someone to develop breast cancer. We're not going to wait for the average risk age that we generally recommend for most women, which is 40. We tend to start monitoring their children or their sisters or their close first degree relatives 10 years before the time that one individual, so that if there is an increased risk for the entire family, we'll be able to hopefully catch it small. And so it's really, really different. Anybody with a family history of a male breast cancer, that increases the risk. Male breast cancers are not common. And so you have to ask the question, why does this man have cancer in their family? Are there other cancers that are linked with that syndrome of cancer syndrome that increases that risk? And so for the average woman, it's going to be at 40. But there are some people who have to start at an early age for a variety of reasons. Genetic mutations are important, and those people who have been tested for genes may have an increased risk. By the time they're 80 years old, their risk could be as high as 80%. And so we're going to do something different for those women.
Okay.
Any questions concerning that answer?
And no, you're answering them very well for us. But let me talk a little bit about, when we go to our OBGYNs and we start to get our testing, we hear words like mammograms, we hear words like ultrasounds. Can you tell us what's the difference between a mammogram and or ultrasounds, and how often should the women get them?
Okay. Once a year for women with average risk. So at the age of 40, average risk every year. You will hear different organizations. There was a big controversy about it because the American Cancer Society actually raised that age to 45, and in some cases 50, because they thought that doing it too soon would increase the risk of false positives. But I see patients in their 20s and 30s every day. And so the average risk is 40 once a year. However, there are some people, like Rashawn just said, she had a lump that was found. The lump was approximately the size of this bottle top. So that's an easy to find lump. She had the lump removed, and usually after a lump is removed, whether it's benign or not, they will order a second mammogram to establish a new baseline. That comes 6 months after, and then every year after that. But again, it's different for different people. So the difference, a mammogram is a series of x-rays. If you think about taking a picture, when I started 25 years ago, we literally used to take a picture of the mammogram, go in a dark room and expose that. Then we moved to digital mammograms, and now we're doing 3D mammograms. That is phenomenal for finding and locating these little lesions. This is a, what do you call it? Paper eraser?
Yeah,
That
erase.
This is an average size lump that somebody, the average size, about just a little bit over 2 centimeters, that someone who never examined their breast, size of this bottle top, can just accidentally, oh, what is this? You don't have to really search for something that big. It's big enough for you to just put your hands on and what is this? This next size right here, this is the size that a person can find when they're doing a diligent search. That means they are literally trying to see if there is something in that breast that that can be found early. And then on this same little object, there's a tiny little dot that big. You can't even see it on your screen. It's smaller than the top of this pen. That is something that for a person who's getting a mammogram every single year, that mammogram can find something that small and even smaller, something that looks like a little grains of salt dropped on or grains of pepper dropped on a potato. That mammogram can actually detect something before it even becomes a lump. We call those microcalcifications. And that's why it's so important for early detection. One of the problems that I personally believe that women of color have with some of the statistics that you've heard about, worsening outcomes found at a later stage, dying young, the most difficult kind of biology. Part of it is because by the time a person comes in, after that lump has started forming, it's the size of this bigger one. It's this big. That's automatically a stage 2 or above. The bigger the size lump or mass, we call a lump, a mass, a nodule, is found, and it turns out to be an invasive breast cancer, the more difficult it is to treat it. Everybody gets different treatments. You can find a lump that's really, really tiny, or this little grains of salt, and may only need to have it removed and nothing else, versus someone that has something that's very advanced, that's going to require surgery, it's going to require radiation, sometimes chemotherapy up front, sometimes chemotherapy afterwards, sometimes pills for 5 to 10 years, sometimes IV treatments for a year. It all depends. Early detection saves lives. Early detections find these things before they are advanced. And we can't always find them early because so many people don't know what to do when they find something. And if they don't have insurance, they don't have a doctor, they don't know where to go. That's where Sojourners can really help. When Linda gets a call from someone and they don't know what to do, or they've gotten that diagnosis and they have other questions, she'll have them call me.
Immediately.
And I'll have a one-to-one conversation and explain it to them after I get off from work. So,
yes, and tell them just a little, Deidre, tell them just a little bit more about the ultrasound, in addition to, because some women have to have the ultrasound in addition to the mammogram screening.
That's true.
I think she wants to hear a little bit about the ultrasound.
Mammogram is an extra test that we can do to further evaluate the breast. Some people only need a mammogram. I only need a mammogram at this stage. I've been getting mammograms since I was in my 30s because my best friend in college developed breast cancer and actually died at 32. That scared me, really scared me. I had just become a nurse. She was a nurse. And fortunately, insurance didn't question my age. They just did it. And at that age, I had dense breast. And so that a mammogram was not enough at my age with my body type. Then I got an ultrasound. As I have gotten older, I'm now in menopause. My breast is fattier. They're not as firm as they were. I can get away with just a mammogram. They can see everything they need to. Some women, let's say I examine you and there is a lump there. You feel the lump, I feel the lump, you get a mammogram, you don't see anything. Well, that ultrasound is another evaluation tool to help us see what is that. Okay. And then again, for those women with the breast that looks like the cloudy sky today, they need an ultrasound in addition with a mammogram. So an ultrasound is a different tool. It does not use X-rays. It is sound waves. It's, if you've ever been in the bottom of a pool and the sun rays came through that water and you saw the sun rays in the water, that's what it does to breast tissue. It just cuts through that tissue and we can see things in the breast in a different way.
The ultrasound really looks inside the breast. So like a lot of times in my instance, like I said before, I did it 2 weeks ago, but they want me to come back 3 months later just to look at it, see if any changes, because that's how fast changes can occur.
So I have something else to add. When a lump is found or a mass is found on the mammogram, that ultrasound will help us to determine, is it solid or if it's just a fluid-filled cyst. Fluid-filled cyst with no other components to it is a totally benign lump. If it caused pain, we can aspirate it, we can put a needle in there and draw that fluid out, and that lump literally disappears. If it's solid and nothing comes out, that sometimes will indicate the need for a biopsy. There are certain features that we see on a mammogram that is more suspicious or more benign. And there are categories that a radiologist can use. There's evaluation tools that they will use, and they will describe it on that mammogram report that will tell us and your caregivers whether or not it's benign. You need to check it in 6 months, or it's been there for years. You can have your regular screening every year, or if it's something that needs further evaluation. And that ultrasound is one of the first tools we'll use to do that. Sometimes it goes beyond an ultrasound and it requires an MRI. Any questions about that explanation?
No, but you giving us fantastic illustrations of,
Yes.
of what we should be looking for. You put it in a term where everybody can understand it. The use of the whiteout, the use of the pen, the use of the bottle top. We thank you for giving it to us in a manner that we all can understand. But earlier you start talking about detections. So tell us, what are some treatments for early detection for breast cancer?
The first thing that we're going to do when we see an abnormal presentation on a mammogram or ultrasound is do a needle biopsy. A needle biopsy is a minimally invasive way of getting an excellent diagnosis with the majority of information we will need to determine what to do next. You get the skin is cleaned, you get lidocaine just like you get Novocaine at the dentist to numb the area. The needle goes in. 3 or 4 days later, we get a biopsy. Is it cancer or not? And if it's cancer, what are the features? What's driving the cancer? Is it your own estrogen that we all have, male and female? Or is it a cancer that has no targets? And so we first want to know whether or not it's cancer or not. We want to know if it's driven by your own estrogen. We want to know if what we all naturally have is a HER2 biomarker. If there's a lot of that tells us how to treat it. If there's a lot of estrogen component to it, that tells us how to treat it. And if there's nothing at all, that tells us how to treat it. So after you get a biopsy, we have to determine the size and whether or not it's advanced or early. And early cancer can just simply be removed. And we always want to remove it, always. One of the things I have to stress is that when we get that result from the person who orders it, and it says you need to come back for further evaluation, I can't stress enough, people need to go back. It's not something that we're going to wait until we go to the family reunion in 2 or 3 months and come back. Or I'm going to have better insurance in 6 months and then I'll come back. Or I want to wait until somebody can get off from work. And we've had people to wait an entire year and come back. And so something that would have started out very, very early has been growing in all this time and can be now advanced. Another thing I want to say is that some cancers grow very, very slow. Some cancers grow intermediately fast. And there are some cancers that are very, very aggressive and they can grow very fast. And so it can go from something that all it needed was surgery to something that we now need chemotherapy, radiation, surgery, even a mastectomy. And so it's different. There's no set guideline for any one person. And I also want to stress that I very often see women who come in and they've gotten advice from family members and friends who may not have ever even had cancer, but they are quick to give advice. Oh, you don't want them to do this, or you don't want them to be that. And I just say, be very careful of the advice you accept from people who are not professionals. Yes. Because it could be something that is going to put you in danger later. I really, really stress when you get a diagnosis or you get results, if you don't understand, advocate for yourself. Ask questions until you get a full understanding. We should all take the time as providers to explain in plain words, plain English. And if we can't explain it well enough, hand the person a plain English pamphlet so that they can think about it and have something to go on, so that you can get the best advice, the best explanation possible so you understand what's going on.
Deidre, elaborate on fibrocystic breasts, because a lot of people, when they do their mammogram, it be fibrocystic. Like I have very fibrocystic breasts, but that's why that one was so big. I didn't realize. I was like, ooh, get scared. But a lot of us have especially a lot of Black women have fibrocystic breasts.
Fibrocystic breast is a generalized term. It could mean a breast that has lots of cysts. It could just simply mean the texture of the breast inside. A lot of women have very, very lumpy, bumpy breasts, and that is their normal. That's normal for them, especially around menstrual periods. The breast inside change depending on the chemical atmosphere of our body. And it can be soft one part of the month and very lumpy the other part of the month, and it could just be plain lumpy. That's one way of defining fibrocystic breast. But fibrocystic breast can also look like a breast on a mammogram with the different descriptions of that breast. It doesn't necessarily mean that you're at risk of breast cancer. It just means that's how your body is made. Fibrocystic breast is a benign condition that many, many women will have at some point, usually the earlier phase of their life.
In 2 minutes, can you wrap up with us the importance of getting screening and additional cancer screenings if we need it? So we're going to wrap it up. And if you could just give us a quick synopsis of everything so we can just go ahead on and turn it back. Once you finish, I'll turn it back over to Charlotte Leonard. So, okay, go ahead.
Early detection. We've heard it many, many times before, is important. It is the hallmark of trying to get the best diagnosis. I'm happy that you have given us this venue to be able to talk to people. Early detection is everything. Start at 40 and have it every year. One of the questions on here is, did the pandemic affect the number of people who have screening? It did. People were afraid to go in and get mammograms. There were centers that closed down because of the pandemic. We saw people with later stage cancers after the pandemic started. And so we encourage everybody, COVID and everything else out there is here to stay. Don't be afraid. Don't let that keep you from coming in to get your annual screening. And early detection means everything. Don't let fear keep you from doing what is best for your life, best for your family members. Get in here, and thank God in Palm Beach County, you have Sojourners with Healing Hearts that is here to help you. We have professionals on board. If I can't answer the question and I can't do what I need, I know people who can. So if you don't have that understanding, please utilize our organization. Let us help you to make those decisions, or at least encourage you to not fear and do what is right. Develop that communication with your physicians, your nurse practitioners, whoever is your caregiver, and don't be afraid to advocate. If you get you have a mammogram and you're not convinced that that mammogram is telling the true picture, do not sit on it. Press further. There are more than mammograms that we can do to get to the end of the story. And I encourage you to do the best that we can, not only for breast cancer, but all of the aspects of our health.
Again, thank you, ladies, so much. Thank you, Deidre. Thank you, Rashawn. Thank you, Linda, for enlightening us on breast cancer. And we do know that October is Breast Cancer Awareness Month. So at this time, I'm going to turn it over to Charlotte Leonard.
Well, thank you all. This was just so enlightening. And every year, Deidre, I've heard you a few times, and every year I learned something new. And I really appreciate women that look like us, hopefully helping and providing education to our community, the community we grew up in, to the kids, the girls, the women that look like us. So hopefully that they've gotten something out of this program, and that we're hoping and helping to reach one life today. And this program will stay posted on the National Coalition of 100 Black Women's social media page. So we're hoping in the future that this message will live long, touch lots of lives. So again, we want to thank you. We want to honor and recognize our breast cancer survivors this month. So on behalf of Breast Cancer Awareness Month, we thank Sojourners of Healing Hearts for spending this 30 minutes with us tonight. But before I end, I want to make sure we have women come out this Saturday. If you are underinsured, if you are uninsured, if you have not had your breast screened, you haven't had a mammogram, and I'm going to go to 30, but Deidre said 40. If you are 40 years old and for whatever reason did not have your mammogram this year or last year, Linda, where can they come this Saturday so that we can hopefully help someone get that mammogram or get the screening that they need?
They can come to Manifest Church, 2275 Palm Beach Lakes Boulevard. And what we do is we will have the mammo van there. And I think at this point, all of the slots are filled. But here's the thing. If they come, we prescriptions for us, and then we will send them to Diagnostic Centers of America so they can come and sign up, and we will send them to do it if all of the slots are filled. So please, women, come out. That's one of the things that we found, and that's why we decided to bring the memo van in the community, is because we were finding that our women were not going. It's not their fault all the time. They don't have the resources. If they don't have insurance, they don't have a primary doctor. And so Deidre is the one that really told us we have to do something to help our women. And so this was the thing that we decided to do. And our project of bringing the van into the community, we love. So, and it's to help our women. And not only that, in the last couple of days, I've been getting women who speak Spanish, and I don't speak Spanish, but, but we want to help any woman that comes to us, and we will help them to get that mammogram.
Well, thank you all for joining us. I think the mission is to help those women in our community that need these services. Thank you again. They have an app though for that, Linda. I just want you to know they have an app to help you with that Spanish. So on behalf of the National
That's true. That's true.
Yes, they do.
Women,
We use it.
say thank you to Sojourners of Healing Hearts. Thank you all for this evening, and we will see you on Saturday at the event. Have a great
Okay.
evening.
Thank
All
you.
right.
Thank you.
Thank
Bye-bye.
you.
Thank you.
you.
Good night.
Bye-bye.